I have a question to Coach Rajesh answer because I I followed your WhatsApp group in India. So I see that you have a very sometimes you have a very specific recommendation for the treatment of the LSD. So if you can share some of your thoughts because it is complicated disease. Thank you, sir.
Yeah, thank you, Dr. Mizan. The year 2022, we had a severe outbreak of lumpectomy disease. There were certain recommendations for treatment from Government of India as well as from the local universities. The issue was that there was a lot of mortality in young calves, number one. Number two, at least 20 to 25% cases were getting complicated. And then people were not able to understand what kind of treatment should be carried out. So I developed a small protocol. And for developing a protocol, what I did initially was came out with staging because that is important. For a protocol to act properly, you should have the staging of the cases. Then you know what you have to do in the first stage, what you have to do in the second stage, and what you have to do in the third stage. So we divided lumpy skin disease into three stages. The first stage was the stage of viremia. Now, in the stage of viremia, what happens? The virus is multiplying. There is viremia, there is virus in the blood, because of which there is fever. And fever is very high, 105 to 107 degrees. Hardly. Now, if you look at the literature for viral disease and also pox, the lumpy skin disease is pox-like virus. The virus is pox-like virus. So, what I did, I searched about what is happening for pox viruses because we have eradicated pox from the globe, but there is always a danger that pox will return, and that is the reason why in United States there is a research station which is dedicated for working on diseases like pox which are not there, but in order to prepare the country, they continue to work. So they have got different murine model of the pox. So I went through what are the advances in murine pox, and from there I picked up that even in murine pox, similar to lumpy skin disease, there are three stages. And what is suggested in the first stage of viremia is not to give any treatment initially. So I advise not even interfering with fever. Because if you look at the immunity which develops, because viral disease, you have antivirals available now, but most of those antivirals are not virucidal in the body. So they will only inhibit the growth of virus, they will not kill the virus. So the basic concept of treatment of a viral disease is that you would like to see that the viral load is brought to such a low level that body is able to respond to it immunologically. And if body can respond, it will develop immunity. And if you see the immunity pathway, and you'll find that fever is one of the important components of immunity. Whenever you take any vaccine, what happens? What happens after taking vaccine? You start fever, having feverish. That is because the body is now responding to that antigen, and that will be creating immunoglobulins, and then immunity will be developed because of memory cells. Lot of people were using paracetamol, they were using non-steroidal anti-inflammatory. As a result, they were suppressing fever because of which immunity was not developing, so the cases are getting prolonged. So we said for first 3 days, just wait. If there is only fever, then just wait. I don't know, just wait and see what happens. In around 80% of the cases, we found that when nothing was given for first 3 days, 80% of the cases treated by itself because the immunity developed. Now, in case of viruses, it is very well known that the current load of virus in the body has to be covered by the immune response of the animal. The immunological attack should be there that only can clear the virus. If you are interfering in that, then the virus will remain for a very long period of time. When you give a vaccine, that vaccine protects only from the future attack. It will not help in the present attack. So many people followed that and they said that about 80% of the animals were getting all right. But there was a catch. In many cases of this 80%, after 14 to 21 days, there was another attack of viremia and fever. That is usually very severe, and that is because of cytokine. You must have heard this name cytokine storm in COVID. So most of the deaths are because of this cytokine storm. So if there is after 14 to 21 days, if there is recurrence, then you have to attack immediately. So then for second stage, we said that to attack we will have to use some antiviral. So there were two antivirals which were recommended. One was methylene blue, which is a broad spectrum antiviral, and then we also tried acyclovir, which is used in herpes. Now, why we use acyclovir in lumpy skin disease? Was because there are lots of literature available which say that lumpy skin disease and herpes virus, if they are present in the body, they act together in symbiosis, and therefore the attack will be very severe. So if you are able to bring down the herpes virus load, the lumpy skin virus also will come down. So we started using acyclovir at the rate of 5 milligram per kg body weight. If it is to be given IV, and if it is to be given orally in case of young calves, then 10 milligram per kg body weight. So young calves up to 3 months of age, you can give oral acyclovir, it is absorbed, but it is not absorbed in large animal. And then another complication in the second stage was swelling. And that swelling was either mandibular swelling or swelling on the extremities. Now, whenever you have got mandibular swelling or swelling on the extremities, it is usually a complication of right ventricular failure because of pulmonary edema. In case of lumpy skin disease, there is severe pulmonary edema, and that pulmonary edema will lead to an inefficient return of blood, and therefore blood will be congested in extremities, and there the fluid will ooze out, and then you will have this edema. So for that, we suggested that if you have got edema in the extremities as well as mandibular, then you have to do two things extra. Number one, we suggested you go for digoxin. Now, digoxin around 8 ml to 10 ml intravenous, followed by another 8 to 10 ml intravenous in the evening, and secondly half of the dose. Usually that is enough. So why we are using digoxin? Because digoxin will improve the heart output, cardiac output. And if cardiac output increases, then the cardiac return will also improve, because of the edema will go down. And along with that, we recommended that instead of using furosemide, because there are lots of problems with using furosemide as a diuretic. And in case of human, now furosemide is very rapidly getting replaced with now new generation diuretic, and that is torsemide. So we suggested that torsemide injection around 10 ml to be given every 24 hours. Torsemide is long acting, then it doesn't cause hypokalemia, and it is 10 times more potent than furosemide. So when people started using digoxin and torsemide, the edema resolved very rapidly. So that was the second stage complication. So we suggested that protocol. And in third stage, the problem was bleeding. The animal starts bleeding through nostrils or even through eyes. These are all around 5% cases will go to bleeding, and this is because of severe thrombocytopenia. So there we suggested that you can use hemostats, and for thrombocytopenia you can use prednisolone at that stage. But prednisolone not to be used in early stages, because prednisolone being anti-inflammatory and also immunosuppression will suppress the immunity. Whereas what we want here is immunity. Another thing we also found out from the practicing vets was that in lumpy skin disease, if there is pneumonia, pulmonary edema, and if you give IV fluid, as Dr. Shiva has rightly pointed out, the animal will collapse. So absolutely no fluid is to be given in lumpy skin disease. On the contrary, you should try to get rid of the fluid that is getting accumulated. So this is the protocol which we developed and circulated, in Maharashtra first, but the protocol went to a lot of states, and then I got a feedback from many, even outside the India also. I got a feedback that the protocol is working extremely well. The mortality, which was around 12 to 15% initially, came down drastically to less than 45% when people started using it. So an important fact I'll try to convey to you is that now there is a need for us to sit down and do staging of all the diseases. Because when you do staging, then you will know what are the cases we are in the initial stage, second stage, and third stage. So that you can develop simple protocols for different stages, and then people will not be confused. And all this should always be compared with the biomarkers. You must have biomarkers to find out whether it is in stage 1, whether it is in stage 2 or stage 3. So we also developed biomarkers, and one of the biomarkers we have introduced this time was calcium reactive protein (CRP). Now CRP is an inflammation marker. So whenever there is inflammation, body will produce CRP, and it's a simple test which is done in most of the pathology labs. See, any surgeon who will go for surgery, before surgery will always ask for CRP test to be done. And if CRP level is high, then he knows that there is some inflammation, infection going on, and that's why the level is very high. So we fix a threshold for CRP, and then found out that a particular, if it goes above that level, then we know that the inflammation is severe, the infection is severe, and then you need to use antivirals. Compared to methylene blue, we found that acyclovir was found to be very effective. Many vets who earlier used methylene blue later on suggested to us that acyclovir is doing extremely well. Recently, we have because one of the problems with methylene blue is that it's highly charged. Because of that, it doesn't remain in the body for a long period of time. But the advantage with methylene blue is that it can be given orally. It is absorbed very rapidly. Absorption of methylene blue is much higher, and the level remains for a longer period of time if you give methylene blue internally. Very fast absorption. So now what we did, we contacted an expert in nanotechnology and explained to him that they would like to have methylene blue, which is not so much highly charged. So he has now come up with a nano methylene blue, which we have recently tested last month, and we find that the levels are high up to 12 hours, and in case of viral pneumonia, we are getting excellent results. So the message here is all the time we have been focusing on bacterial infection, whereas now emerging problems are viral infections, and therefore we need to also start, looking at what kind of antivirus we are going to use. I was going through that Japanese foot and mouth disease outbreak of 2010, and then what are the developments that is taking place. There are 3 or 4 groups globally which have become very active in finding out antiviral drugs for diseases like even foot and mouth disease. They have come out with 2 or 3 molecules and tested on animals, and they find that those are very effective. And the reason they are saying is when you do FMD vaccination, it takes time for the immunity to develop, and you need some handle, some tool to cover during that initial risk period. And for that, they have started developing antivirals, and one of the antivirals they have pointed out, which they have currently used in pigs, and they find that when it is given to pigs orally, the virus is getting it out. Another development which is taking place in foot and mouth disease is last month I visited one lab near Minneapolis, Eagle. That is a lab which is doing gene editing. So remember, there was some 4 years back, a group was given Nobel Prize for that CRISPR technology, gene editing. So that is a lab for gene editing, and there what they are doing is they have found out that FMD virus when it enters into body, it gets first attached to a receptor, and then it gets internalized. So they have found out the nature of the receptor, and also find out that there are few cattle which will be in the midst of a severe FMD outbreak, but will not have disease without even vaccination. And they found out that they have a gene which is slightly different, than the normal receptor gene. So they have taken out that gene and then inserted into, through embryo, inserted into pig. Right now they have done with pig, and now they have got pigs that are resistant to Ptomaine disease. And with that group, now we are signing for India an agreement to replicate same experiment in cattle. They can't do it in cattle over there because of legal restriction. So lot of new developments are taking place, and I think slowly we are coming to a stage where lot of such animals, will be in the market, which will be resistant to, diseases, resistant to infections, and then vaccination and treatment, probably will become, and this is going to be very fast because they could do it in 2 to 3 years. They could do this. They have also got, cattle which is resistant to, climate, very high temperature. They found some slip gene, and that slip gene they have inserted into cattle, and now I think probably within 2 3 months we will be importing the semen of those bulls. It is a dominant gene, and if we will be able to then inseminate and produce such cattle. So these technologies are spreading very fast. One more thing I wanted to point out when Momena was giving a presentation about oxytocin. See, oxytocin has got a half-life of only 6 minutes. It's rapidly broken down. Therefore, if you want to use oxytocin for intrauterine contractions, never give it in one shot intramuscular, because then it will have only very limited time effect. So it should be given IV, very slow, continuously, or at least 4 to 6 hours. Then only you will have effect of oxytocin and contraction.
Thank you, sir. Thank you very much. আমার সাথে যেটা বলছে রামকৃষ্ণ নিজের ট্রিটমেন্টের প্রোটোকল যেটা বলছে সেটা স্যার আমার সাথে শেয়ার করছিল। এটা আপনাদের দিয়ে দেবো আমি, দিলে ওটা পড়লে আপনারা বুঝতে পারবেন এবং কোন স্টুডেন্ট ট্রিটমেন্টে যাবেন। Thank you very much. So I have another, now my next question is to Dr. Shivaraman. So you showed in your presentation that if the memory gland is harder, fibrous harder, we were talking about treatment with potassium or sodium iodide. We also thought that sometimes we can use the corticosteroid. What is our experience with corticosteroid? Supplementing the fibrous harder. And what is about at the same time, let's share your experience about the potassium or sodium iodide. Thank you.
So corticosteroids, they won't reverse the fibrosis. Also, it is not indicated in the therapeutic management of anti-mastitis. Even in textbooks, they say you should not give corticosteroids continuously to treat for adult fibrosis. So they mentioned at least one time dose. That's all. Corticosteroids. If there is any serious, if you are using it continuously, means definitely that will lead to augmented access and all. And also, corticosteroid does not play any role in reversing the fibrosis or anything. That's one thing. Another thing regarding the use of potassium iodide or sodium iodide, sometimes it is not giving a 100% curable for fibrosis. I mean, after giving potassium iodide, you cannot expect the complete adult fibrosis to become normal. It's one of the line of treatment we can try it. And sometimes in adult also you may be coming across hard fibrosis mass or wound like will be there. So localized active fibrosis will be there sometimes. That also you can use this potassium iodide. Under fibrosis, there are some commercial preparations. They are using this potassium iodide at a minimum level, like 1 gram, 2 gram, like that. They have added, and they are using as an anti-fibrolytic agent also. So in these two aspects we can try it, so that we can, it depends upon the each and individual cases. But we cannot expect a 100% guarantee of reversing back of the fibrosis. That is in such a cases we can go for alternative therapies are available, that we can try it in some other treatments are available, like homeo applications of homeo medicine. For long 3 weeks or 4 weeks, it can slowly some cases will get improved. That is the thing. So potassium added is not a complete curable for other fibrosis. It can be used. It will prevent fibrosis to some extent.
You see, actually, in case of actinomycosis, if you read old literature, 1940s and 50s, when antibiotics were not available, people were using lot of these substances, for treating infection. Now, in case of actinomycosis, if you want to use potassium iodide or sodium iodide, they don't use potassium iodide to be used orally, and sodium iodide you can use if you want intravenous. Now, there, they describe that its effect in cases of antimycotic and actinomycosis or actinovaginosis will happen only when you have given enough of iodine to cause initial signs of iodine toxicity. Then only it is effective. So it is, you will have to give it for a longer period of time, to such a time when you will get initial signs of iodine toxicity. And the initial sign of iodine toxicity is rough skin hair. The moment you start seeing rough skin hair, then you have to stop. At that level, they say, but these kind of iodides are acting as antibacterial. Another note of caution about levulside. In India also, people were using levulside extensively intrauterine, thinking that it will act as antibacterial, but it has got lots of problems also. You should remember. We have seen lots of cases of salpingitis and then occlusion of the salpins, because of iodine. Because look at iodine. If you inject iodine intravenously and if you don't keep it properly intravenously, if it comes out, there is a huge sweat. It causes tissue reaction very fast. And therefore, endometrium, which is a very sensitive tissue, there if you are giving levulside, which is strong enough, it is not very diluted, in that case you are going to cause a lot of reaction to the endometrium. It might slough off in some cases, but it may also cause a lot of harm. So you will have to judiciously choose, judiciously choose the cases where you will do levulside. Generally, we recommend not to give anything intrauterine under our scientific conditions and hygienic conditions, simply because while giving, you are also likely to introduce infection which is not there in the uterus, and then if you want to give intrauterine at that point of time, cervix needs to be open. Otherwise, cervix is closed, you can't give anything in intrauterine. If there is pus, if there is organic matter which is accumulated in uterus, then your antibiotic is not going to go to the endometrium where there is infection. So there are a lot of these issues. Earlier there were also preparations like furosemide and urea, used to correct urea, and then they found out that this urea was so toxic that it was causing harm. The company had to withdraw urea products from the market. So therefore, all these preparations which are going to cause irritation has to be used with no caution.
Thank you, Professor Dr. Abdul Samad. Dr. Lance speaks about LSD and others. I have a question. There are a lot of drugs in our country to increase the immunity level. Number one question: those drugs can you use to the fashion from the beginning of the infection, and also it may be used to prevent this LSD from developing from this disease or LSD.
As far as I understand, the question is, can we use the drug used to boost up the immunity, right? can we use the drug to boost up the immunity? Yeah.
আমি বাংলা বলছি যে এলএসডি আমাদের দেশে ইমিউনিটি লেভেল ইনক্রিজ করার জন্য অনেকগুলো ওষুধ পাওয়া যায়। এই ওষুধটা এলএসডি যখন শুরু হতো, প্রথম থেকে আমরা এটা ব্যবহার করতে পারি না। যদি ব্যবহার করি তাহলে এলএসডির যেটা ইফিকাসি কমে যাবে। অথবা আমরা যদি একটা ফার্মে হয়তো দেখা দিল এলএসডি, সেক্ষেত্রে অন্য একটা পার্শ্ববর্তী ফার্মে আমরা পূর্ব থেকে আমরা জানি সাধারণত পার্শ্ববর্তী খাবার হলে অন্য একটা খাবার হয় সাধারণত। সেক্ষেত্রে যদি একটা খামারে দেখা ছিল পরবর্তী পাশে আর একটা খামারে আগে থেকে যদি আমরা এইসব ড্রাগগুলো ব্যবহার করি, সেক্ষেত্রে যখন এই রেসিপি অ্যাক্টিভ হলেও অর্ধেক কমে যাবে। এগুলো করা যাবে না।
Any immunomodulator drug is available where LSD or in one form and another term used immunomodulator drug that prevents
This is a question, which is very routinely asked, and I had a group called, LSD treatment group during 2022. It is still there. Whenever there is a lumpy skin, problem, people post. Dr. Mizani is part of that. Now, in case of lumpy skin disease and many viral diseases, the major problem of mortality is cytokine storm, over immunity, over response of immunity to virus. And instead of causing only problem to the virus, it is causing more harm to our own tissue. So therefore, in lumpy skin disease, you have to be very careful that you want to suppress the cytokine storm, and you would like to see that from the virus specific immune response is created rather than non-specific immunity. So we ask most of the vets not to use any immune modulator or stimulator, at least during the lumpy skin active disease process, and let the body respond to the immunity which is specific immunity. Now in other cases, the immune modulators and the immune booster is a very gray area. If you talk to all those experts in Western countries, and the moment you talk to immune stimulators, they raise hand saying that it's a very gray area because there is no evidence. The problem is when you use any drug, its impact is to be evaluated based on certain evidence. So what is the evidence of immune modulator? What is the evidence of immunity booster? People talk of various tests, but those are all very non-specific tests. So that's a very gray area, but it's a very stimulating area. There are a lot of drugs that are available as immune stimulant. And most of these drugs that are talked about are either herbal in origin. So you see lot of formulations that are available in under the herbal mixtures. And my basic objection to all these herbal is the knowledge of their pharmacological activity has come from human. Okay, so human or other experimentation. Now, in case of human, I can understand because most of these, if you look at the pharmacology, I think there must be some pharmacology person also here. Most of these active ingredients are either alkaloids or glycosides. And if you go to the literature, you will find that in case of ruminants, when you give any alkaloid or glycoside, it is 100% broken down in rumen. So you are trying to replicate a model of simple stomach directly applying it to ruminant. Now, when I am giving them cellulose, I am giving them, straw, which is so hard to digest with liquid, etc. And if I give that to the ruminant, in rumen it is getting anaerobically destructed into elemental form nitrogen, right? If it is protein, nitrogen, and all other elemental form. And if it is carbohydrate in nature, it is converted to volatile fatty acid. So nothing remains as it is in rumen. Rumen is a vessel which is there for destroying everything to elemental level. and these elements are then captured by microbes, internalized as their body composition. They expand and multiply, and these microbes will go to intestine and get digested. So entire digestion in case of ruminant is not direct. For example, in case of human, if I take protein, it is broken down to simple peptides and absorbed as simple peptides. If I take sugar, it is absorbed as sugar. But in case of ruminant, doesn't happen that way. So if everything is broken down, where is the evidence that the herb which you have given has remained stable in rumen? I have asked this question in all the groups and nobody is able to give me reply to that. And the only thing they will tell you is there are 10 herbs, and therefore very difficult to find out. So we tell them at least find out one herb which is getting absorbed from intestine. If an alkaloid or glycoside has to go and act on uterus, that has to get absorbed from rumen or from intestine, should appear in blood, then it should go to uterus to have its action. If it is not getting absorbed, if there is no evidence, then how can you say that it is increasing the uterine tone or it is increasing uterine contraction? So that is again a gray area where lot of research is needed. Of course, I am not against her. They are good. They have got pharmacologically active ingredients, but the basic hurdle is rumen. It is not stable in rumen. Therefore, it is highly questionable whether it will have any impact on the disease or whatever pharmacological effect we would like to have.
Hello. I have three questions. Number one, how we differentiate among these three: amoebal infection, ruminal infection, and intestinal block by airball or forest fiber block.
Amoebal infection, rumen infection, and the intestinal. So in rumen infection, if you palpate the rumen will be very hard in nature, like a stone. And during the rectal examination, you can able to feel the large quantity of dung will be there. Dung will be there, with associated with the rumen will be very hard in nature. That is a rumen infection, ruminal infection. So one thing it is related to the feed, overconsumption of any paddy straw or anything, just it will get impact. Another one. Second reason, it could be a case of peritonitis also. In peritonitis also, there will be motility disorder and the rumen will be getting impacted. One thing, that is one. In abomasal infection, so the dung will be scanty in nature. It's a post-stomach disorder. No? So when you do the rectal examination and you take it out, you can able to see the scanty pieces. When your glove is considered with a little quantity of the pieces, that is indicative of abomasal infection. Intestinal obstruction means complete absence of the dung. You do the rectal examination and you take it out, there won't be any, even a small particle of complete absence of the dung, or raspberry jam-like appearance, or only mucus alone is present. This is a clear case of intestinal obstruction. In intestinal obstruction, there are two forms. One thing is the functional obstruction, that is intersusception. Another thing is the physical obstruction by any phyto disorder. In both the things, you will be getting the same, like a complete absence of the dung. Sometimes during the rectal examination, you can able to find out the hard mass very easily. You can identify. Sometimes it may be deep in nature, you cannot able to palpate. Sometimes you may get it in the right side. Yeah, large mass. That is called a cecal dilatation or cecal environment. Like that, complete absence means it's an indicative of intestinal. This is how we can differentiate. There are other one method is also there to prove the abomasal obstruction, I mean infection, and drenching of 2% of this activated charcoal orally, and after 2 hours doing abomasal synthesis, you can able to see whether the charcoal is aligned with abomasal. Rather than that, by physical examination, by rectal examination itself, you can able to clear these three things.
Okay, thank you. The second one is in this March and April, bovine behavioral fever is a very crucial problem in our country, especially pregnant cow and heifers. Usually we keep like water therapy because the temperature is very high, 104, 106 degree, and complete rest and give them NSAID. And sometimes we use proper diet. But besides that, some animals after treatment, after a few hours of treatment, animal get open mouth breathing and subsequently develop generalized subcutaneous edema, and the animal cannot lay down till die. And after postmortem, we found that the lungs is almost 3 to 4 times larger and the alveoli were separated. Have you any different treatment protocol to save these animals?
I understand. The subcutaneous emphysema is one of the complication of human fever. Sometimes it may not occur in all the cases. We may be getting in few cases like that, and either it may be due to ephemeral fever or any drenching also. You have to verify whether they have drenched anything, powders or any liquid item, and got aspirated. So, subcutaneous emphysema is a common sequelae of ephemeral fever, and there is no separate treatment. But once emphysema formed and it is coming under the skin and all, the prognosis will be mostly grave. So, you have to see whether it's a generalized subcutaneous emphysema or localized. Sometimes it may be localized in the neck region alone. The animal will be waving the tail, drinking water, means slowly it will recover. Generalized subcutaneous emphysema means the prognosis will be mostly unfavorable one. So you can treat it, you can avoid fluid therapy. Don't go for any fluids, and you can give broad spectrum antibiotic like Ceftriaxone and diuretics and anti-inflammatory for 1 or 2 days, and you can try it. Yes. Anything?
Yeah. We have been getting such cases in our state, and mortality in these cases very high, especially in buffaloes. In Mumbai, there is an area called Are Colony where there are around 75,000 buffaloes in one area itself. It's a government buffalo colony, we call it. So their number of deaths have happened, and then they tried all kinds of antibiotics, but nothing helped. So here we found out after investigation 2 important issues you must take into consideration. Number one, many of these cases are because of virus, which is bovine respiratory syncytial virus. And we found that it is very common, and usually it starts with bovine syncytial virus, that is the Vinicius. And this happens in all those farms where they use lot of water and there is humidity in the farm, wet days in the farm. Because wet days will always favor viral replication. Number two, where animals are tight and density is very high. So therefore spread is going to be much faster than the animals. So here you have to consider antiviral, number one. And number two, there are also cases which we have recorded in large animal as well as in goat, and that came out to be mycoplasma. And so happens that whatever antibiotics we use, they are not effective against mycoplasma. So you have to choose specific and antibiotics which are effective against mycoplasma. So what we have started doing in these cases is we ask them to either give acyclovir, but if they are not able to afford acyclovir because it's quite expensive, we ask them to do Methylene. So they start on the first day when they see respiratory signs, they start giving Methylene blue twice a day, and then after third day, if the symptoms have subsided but not completely over, then we say okay, now there could also be secondary infection, so you can give antibiotics. So that is the protocol. Many people are now following. Only last week I attended one big outbreak of pneumonia in goat, a big goat farm, which they keep for fattening purpose. And in a day, 40 bucks died. And then when I visited, it was very difficult because there is one differentiating feature between bacterial infection and viral infection. viral infection will always have fever which is more than 105. Very severe fever, that means it is viral. And if it is below 105 degrees Celsius, then usually it is bacterial. I'm saying usually, I'm not saying exclusive. So usually it is bacterial. So all those cases were having 106 degrees Celsius. So what I did, I immediately took nanometer glue with me and I asked them to start feeding to severely ill cases 10 ml orally, and for all other road, put in water in diluted form so that it goes to all the road, and next day the mortality stop. So it looks like virus is now probably our major enemy, and we have to start using it. And we are not the only one to start now antiviral. There are lots of countries who are looking at antiviral, drug development in case of for large animal disease. So therefore, we must look at antiviral therapy now very closely and start, treating our cases if you suspect it is because of virus.
My third question is, I'm practicing in dairy for last 9 years, and I found some cases like the animals does not seek too much, but after post-mortem we found that some parts of intestine or ammonia leak, and just and it just spread throughout the abdominal cavity and subsequently develop what is yes peritonitis, and actually this is happened for 2 to 3 times, but I did not diagnose before death. What is the procedure to save these animals?
First, what about the done in the present when you are approaching the case? What about the done quantity? Is it reduced or complete absence?
Actually, I did not notice very carefully, but I found sometimes fever and sometimes found some just before the skin is leg to the abdomen, only these 2 signs, and after that within a few hours noticed the animal was dying.
Only I think there is any rupture, just rupture only, all these contents will go into the peritoneum. Or otherwise a delayed case of intestinal obstruction, delayed case. Suppose it's a delayed case, starting peritonitis, when you do that rectal examination, you can able to feel adhesions. So whenever there is adhesion, anything, sometimes they lead to rupture of the intestine. So you have to verify it is whether it is due to any intestinal obstruction is there or not. That could be the possibilities. Clinically, we have to watch it.
But hands only go through the rectum, but how we feel the other spots of the
Yeah, because only the thing during the rectal examination, you can able to feel the left side, you can able to feel the rumen. It will be very hard in nature. In the right side, if it is a engorged one, it indicates a cecal dilatation. And you have to take your hand out, no, you have to see whether the dung is present is or not. If there is empty, complete, no absence of dung means it could be a case of intestinal obstruction. So in case of adhesion, you can able to have a slippery flow. As if you are applied oil or liquid paraffin in a glove, or you can calculate, you can able to have a slippery flow in the rectal wall. In such a cases also rupture may happen. The delayed case, not in the first. It could be a case of delayed case. Only if we clinically examine, we can able to confirm.
I don't know whether here people are using what is called as ferroscope. Ferroscope. It's a simple device which many vets and paravets in India are using for finding out because they don't have X-ray in every hospital. So how to find out there is a foreign body in the table. So they use ferroscope, which is a strong magnet. Okay, so they will at the reticular area, both on left side and right side, they take that ferroscope, and that ferroscope will give if there is any foreign body, it will give reflection, and with that reflection they find out whether it is foreign body. Now the problem comes, most of the animals will also have some other kind of foreign body in reticulum. It may not be penetrating. So how to find out that it is penetrating? So in that case, what we suggest that there are two approaches available to you. One is once you do ferroscope examination, you will find the animal is positive. In that case, you go for differential leukocyte count and total leukocyte count. And if there is shift to left, that is we have got more band cells, then more than 10% band cells, then we say that it's a infection, it is penetrating. The other test which we are promoting in some lab is again same calcium reactive protein. We are saying that if calcium reactive protein level goes higher than 15 milligram per deciliter, and if ferroscope is positive, then it is probably a case of penetrating polyp.
Thank you, sir. I just want to add one thing. I indicated that the answer, whose species was it? Poultry, goat, or large animal? That's one thing. But in case of large animal, for artificial insemination, sometimes the AI technician mislead the gun to the sub-ureter diverticulum instead of passing the cervical ring. So if that is the case, they can easily rupture the subureter diverticulum and it can penetrate the peritoneum. It can be one problem. Thank you.
I have a question on the FMD. That I have faced the last year in February 2023, that is the huge crop mortality. So how will we take the prevention measures against the FMD in day crops or the 3 months or in dead crops?
Again, from last month we have started conducting a trial because calf mortality we found in Maharashtra very high in the current disease outbreak, which is because of serotype O. So what we have started is giving antibiotic, methylene blue, and we are finding out that if we give this nanomethylene blue for 4 to 5 days, continuously morning and evening, then the virus load is slightly decreased. But again, we found that mortality was still high because of myocarditis. And there we have suggested, using lidocaine to be given for 3 to 4 days to correct myocarditis and arrhythmia. And people are finding out good results from it. We are also finding out the heart involvement in foot-and-mouth disease in many adult animals also now. So there also they are using lidocaine, and there is a protocol which I will share for treating cardiac involvement in case of foot-and-mouth disease with Dr. Mizan, and maybe he will be able to circulate it. But in long term, if you want to protect your calf from foot-and-mouth disease, you will have to start vaccinating the cows when they are advanced pregnant. And when they are advanced pregnant, when you vaccinate, not only vaccinate, I say you hyperimmunize. We give FMD vaccine repeatedly 2 to 3 times during late pregnancy. Don't worry about abortion, because in case of cow, Dr. Momina will agree with me that there are 3 layers, and in case of human, larger layer is only 1. Whereas in case of ruminant, we have 3 layers. And when a calf is born, it's absolutely devoid of any antibody. And you know what is the molecular weight of antibody? So even antibody cannot pass from maternal circulation to the fetal circulation. So therefore, these vaccines, which are protein in nature, are larger enough and it will not pass. Suppose if it passes also, we know that after around 160 days in of development in the uterus, the calf becomes immunocompetent. So even if there is any exposure to infection, for example, they have found that bovine viral diarrhea can cross the placental barrier, and they have found that if there is an outbreak of bovine viral diarrhea and the animals were pregnant, most of the calves were already having antibodies, in their blood for BVD, because the virus could transfer from placenta to the fetus. Otherwise, no other virus, no other protein molecule will cross. But what will happen if you hyperimmunize? When the cow will give person, it will be having enriched antibodies, specific antibodies against foot-and-mouth disease. And when the calf is fed this colostrum, it will have passibility at least for 2 to 3 months because we give first vaccination after 3 months. That is in long term. And here you have to remember that you should be very careful about maternal antibodies also when you would like to give when you want to vaccinate the calf. Because if there are circulating maternal antibodies, it will interfere into vaccination if you are doing it early. So never do early vaccination in case of those calves which have received colostrum from vaccinated dogs. So you can delay and then after 3 months you can start. And do vaccination repeatedly at least for first 3 years, every 6 months, irrespective of any outbreak in the vicinity, you should vaccinate your animals. And then whenever there is an outbreak in the vicinity, again do a booster vaccination. If you do this for 3-4 years, then your herd will get protected. Any animal which is coming from after purchase to your herd should be vaccinated and should enter. So all your animals more or less should be at the same immunity level. If you do this, your herd will be protected from foot and mouth disease, your calf will also be protected from foot and mouth disease.
Sir, if we use the intravenous soluble card, like it has any benefits against the acute treatment?
See, soda bite, you see, this virus, FMD virus, is sensitive to highly acidic pH and highly alkaline pH. So acidic pH below 4 and alkaline pH above 8. So you cannot use soda bicarb intravenously at that pH level. That's why we use it. Now another issue, all along we have been saying that for disinfecting the farm, we use hypochlorous, chlorine kind of disinfectant. Now recent evidence has come that if this hypochlorous solution is stored in open, that is open to light, and if it is not stored in cool, it loses its virucidal activity within a month. So therefore, storing this will not have any effect. On the contrary, now there is one new disinfectant has been proposed, and that is calcium bicarbonate. And they find that calcium bicarbonate at 4% concentration has got a shelf life even for 4 years, and you can store it at any temperature. You can also store at ambient exposed to the sun or the light. So now many countries are shifting from hypochlorous as a disinfectant in case of FMD to calcium bicarbonate.
My expectation was any one of today's research person will discuss about transition period management, but did not. I would like to request Samal to give some ideas regarding transition period management.
Very good question, and very critical question also, because a lot depends on transition management. Now what happens? I'll talk more about the conditions prevailing in our country rather than talking about what is happening in developed countries, because they have a very different kind of system. They can afford to have balance fashion, EMR, all those things. They can afford to have. Our farmers find even doing small things also very difficult for them to adopt. So now what happens when the animal is dry, not giving milk? At that point of time, the farmers do not give any concentrate, and even the fodder which is given is also low. I don't say that the pregnant animals which are dry should necessarily receive concentrate which is not there. If you are able to meet their energy requirement through fodder, that is best. So if you are feeding them silage sufficiently, ad libitum, 30 kg to 35 kg or up to 40 kg, then it is fine to, it will meet their energy requirement. The energy requirement for pregnancy goes up tremendously, after 5 months. Then the fetus has started developing faster, the requirement of energy is also high. But then they don't feed, sufficiently during the dry period. As a result, the body condition score, which should be more than 3.5. Tomorrow, when we will be taking round of the farm, that time I will be also describing you how to score body condition in case of pregnancy. What points are to be noted down. So the general rule is at the time of calving, a cow should have a body condition score of around 3.5 to 4, but never above 4, because if you go beyond that, then there is likelihood of what is called as a fatty liver syndrome. So you should have 3.5 ideally as a body condition score, and that means that the animal is having enough reservoir in the body to meet the energy requirement. Now the calving takes place. We generally do not appreciate the trauma and the pain the animal is going through during calving process. That is mostly a very neglected area. We don't manage the pain of calving in case of animals. So we just disregard, and sometimes we are also very cruel with the animals. While handling, if there is any difficulty or difficulty, we try to push and do all sorts of things. Even normal, calving process is also very painful. So many countries have started now paying attention to pain management at the time of calving, simply because when animal is, going through this pain is reflected in less dramatic way. So the first thing that will happen because of pain is animal will take less pain. And now after calving, the colostrum is synthesized, milk is getting synthesized, so the requirement of feed and requirement of energy has suddenly gone. But animal is not, taking concentrate because of pain. Number 2 problem, if you are not sensitizing rumen for concentrate feeding before calving, and suddenly if you start, giving, concentrate mixture, then rumen is not adjusted. Remember, ruminants are not like us, where today, I would like to have biryani, tomorrow I would like to have chicken, Thursday I would like to have something else. No, ruminants, don't want to do that, because their, digestion is anaerobic fermentation, which is dependent on microflora. And there are microflora which are different for concentrate, microflora different for cellular digestion, microflora different for different ingredients. So if you are not sensitized rumen and suddenly start feeding them concentrate into this lot of starch, the microbes are not ready to digest starch, and therefore animal will have lots of problems. In many farmers, I don't know from where it has come in mind, and our extension has not reached to them. There are areas in our country where farmers feel that concentrate should not be fed up to 1 week after calving. They just be told, and then another bad thing they follow is after calving, no feed for 48 hours, and give only water. I don't know from where it is coming. So they will do all these sorts of things. So when the requirement of energy is very high, and if the body condition score is less, if your rumen is not sufficiently sensitized, then you have this problem of transition problem where animal goes into negative energy balance. So therefore, your transition management will start at least 30 days before calving, and then it spreads to 70 days after calving, and that is why it is commonly called 100 days contract with the cow. So we tell farmers that you enter into this contract with your cow, take care of this cow for 100 days, starting 30 days pre-calving and 70 days post-calving, and then this cow will give you enough profit, because 50% of the milk you should get in first 100 days, because there is lot of hormonal influence. And this hormonal influence, what it will do initially, even if you are not feeding, it will draw nutrients. It's just like there is some cash in the bank, and you require that cash, so you will start withdrawing cash from the bank, and after some time you find that your balance in the bank is zero. Same thing happens here, that energy which is coming from reservoir, like glycogen, etc. is not there, then the body will go after fat. So fat catabolism will start, ketone bodies will be formed. Now these ketone bodies will be having their own toxic effect. So the first effect of transition, bad transition management is higher fat percentage in milk. So tell farmers that if you take milk and go to the milk collection center, don't be happy if there is sudden increase in the milk fat. That is an indicator of negative energy balance and fat catabolism. And there some corrections are needed. Now for this, there are a lot of research has been done as to what should be what should be the tools to manage the transition curve. The problem here is they need glucose. When we say negative energy balance, the currency, the requirement is glucose. Glucose is the main, energy source. And because this glucose, when it is, used in PCA cycle, it will produce ATP. And ATP is the currency of the metabolic activity. Any activity, biochemical pathway that is happening is using ATP. And ATP is needed, and ATP comes from glucose predominantly. So therefore, the requirement of glucose is very high, but the problem is rumen. That if I give lot of starch, it will get digested into volatile fatty acid, propionic acid, will produce huge acidity. If I give glycerol, if I give propylene glycol, lots of it, again it will be converted to propionic acid, will produce acidity, will decrease the appetite, which we do not want. At this stage, what we want is good appetite, good parameter intake. So therefore, now we have come up with a solution where micro encapsulation has been done for all these carbohydrate products, so that it can bypass lumen and directly go to the intestine. And when it gets released into intestine, directly glucose is formed instead of volatile fatty acid, and then this glucose will push the energy level, and you will get good milk yield. So there are two interventions which we have proposed. The first intervention is in between 7 to 21 days. You give protected glycerol or protected propylene glycol, and then after 40 days, if there is milk loss, give protected starch. So this way you will be able to manage. Of course, some starch can also be added in terms of maize and other things can be added, but don't go beyond 1 kg, because if you go beyond 1 kg, it will cause loss of lot of acidity. One more point I would like to add at this stage, it is finding out what is the genetic potential of your animal. Usually people say that you will have to go to genomic and all those things, but there is a very simple way of roughly estimating the genetic potential or the lactation performance potential of any cow. That is, in the first month, 3 best records, milk record, 3 days best record, or 3 times best record, you take an average, and that average then can be multiplied by 1.5. So that is, of course, we have developed for Indian conditions. So when you multiply it by 1.5, that is the expected peak yield. So from first month only, the farmer should know what is the potential peak yield I am going to get at around day 21 to 40. If it is earlier, it is so good, because if peak is early, the peak will be maintained for a longer period of time, we will get more milk. And then once there is a peak, suppose let's say the peak is 15 liters, so multiply that by 200. That becomes the potential lactation yield. So it's a very simple and thumb rule kind of estimate for finding out the genetic potential. And that will allow the farmer to understand the potential of a cow, and accordingly he will do focus. So this is an important activity, but for that what we need to do is record, milk recording. And milk recording at least 3 times or 4 times in the first month, and then later on at least every month is important. And if you have that, then you will be able to understand the problems related with nutrition and what problems if you understand, then you will be able to take corrective. There was also discussion about prolapse of rectum prolapse of vagina, those kind of. In my practice, I have found that if it is more than 2 cases in a farm in a year, then that will tell you it's a problem which is related with nutrition and it's not related with ligament, etc. And that is a problem of not balancing protein. If you give lots of protein, and this is again a myth which has come, I don't think from, I don't know from where it has come. Even in India, there are farmers who give concentrate mixture with 26% protein, 28% protein, and they'll say my animal is very light animal, giving more milk. But milk doesn't come from protein, but they give a lot of protein and end up with this kind of problem. So if you give more protein, this protein will be digested in rumen and digested into nitrogen, and nitrogen will be captured by bacteria. If you are producing more nitrogen, which is not handled by microflora, then it will be absorbed through rumen epithelium, will go to liver, get converted to urea, and then you get buildup of urea throughout the body, including uterus. So I have found cases where the blood urea nitrogen level, which should be less than 10 milligram per deciliter, has gone up to 200 milligram per deciliter. And recently I did one survey where we examined 200 blood samples from one milk processing area, and we found that 99% of the cases were having blood urea nitrogen which was 40 milligram and above, whereas ideal is below 7 milligram per deciliter. If you have got enough of urea built up in uterus, animal will have infertility related problem. Animal will have problem related with loss of tone, and when there is loss of tone, it is very much prone to collapse. And the best way of doing is to milk urea nitrogen. So we very routinely do milk urea nitrogen and try to balance protein to bring it to below 7 milligram per deciliter even in milk. And if you do that, I find that if you give with good silage, if you give concentrate mixture which is between 60 to 18%, I think that is more than enough. But you need to calculate the total protein requirement. So generally what people do, we only look at concentrate and do not look at the stuff that is coming from the bottom. So combinedly, as Dr. Pasha has explained to you, combinedly you have to consider what you are feeding. Overfeeding is going to give you losses because you are feeding more, because you are spending more money, and it is also not in the interest of the cow. So balancing ration, with some evidence is important, and the evidence is, I do what is called as metabolic profiling. So very routinely I follow this. I pick up at least 6 or 10 cows, collect blood, and do certain tests to find out whatever I am feeding is appearing in blood or not, whether the blood glucose is normal, serum cholesterol is normal, serum protein is normal. So I look at all those parameters, and then I am serum calcium, serum phosphorus, serum magnesium, and then I am satisfied that whatever we are feeding is really helping the animal. So routinely doing metabolic profiling, routinely doing time testing to find out whether everything is getting digested, whether large particles are not appearing, grays are not appearing in dung. These are important issues. If you do, you will be able to prevent lot of such problems.
Okay, thank you, sir. Thank you, sir. Actually, maybe you are tired, so many answers will be there. And all introduced to the first group work with it. So I can understand something. So my question is, বাংলায় বলবো আমরা যে রিপিট ফিডিং সিনড্রোমটা ডেফিনেশনটা জানছি, এই ডেফিনেশন কত বছর আগে এটা ট্রাই করলাম। ফিল্ডের এক্সপেরিয়েন্স কি বলে যে একটা 10 বছর বয়স একটা বাচ্চা দোষে 3 বার এই করা হয়েছে, কনসেপ্ট করতেছে না। ওই রিপিট ফিডিং ডেফিনেশনের সাথে ফিল্ডের বাস্তবতা কিছু ভিন্ন। বাচ্চা দোষে 3 বার, এই করছে 10 বার, বয়স হলো প্রায় 10 বছরের বেশি, তারও বেশি, কনসেন্ট্রেট করতেছে না, তার সিমেন্ট কোয়ালিটি ভালো কোয়ালিটি, যেহেতু সিএস থেকে সিমেন্ট আসলে সিমেন্ট কোয়ালিটি ভালো, তার জেনেটিক ম্যাটেরিয়াল, জেনেটিক পটেনশিয়াল অল আর এভরিথিং ইজ নরমাল। তার প্রত্যেকটা তার সাইকেল ডিউরেশন 20 days, 80 to 20 days, it's normal. The mucous membrane, mucous color, everything is normal. Clear crystal. Our body condition 3.5, up to 3 to 3.5. So what is the condition? So in my case, আমি আমার উদাহরণ দিচ্ছি এখানে, তারপরে in my আমারটাকে বলি তারপরে ইংলিশে কিছু বলতে। In my case, যেহেতু বডির ভিতরে সবগুলো অর্গান sterile, there is no organism. So when 80 times you feed the AI, there is some organism goes to the uterus. Definitely. After one organism or two organisms. So if you feed at least 3 or 4 times AI, there is so many organisms goes to the uterus. So very possible to subclinical enterocolitis. But it is very difficult to identify which animal is affected by this subclinical enterocolitis. But there are some research to indicate that if the urine wash or sometimes either moisturize or sometimes metronidazole or sometimes omeprazole in diluted conditions, and then next time AI is okay. But what is the difference between that definition and that definition that I did in the books? So I think in Physiology Society or Physiology expert, maybe this definition must be changed in the time given. ফিল্ডের বাস্তবতা এবং এই বাস্তবতা টোটালি ডিফারেন্ট। থ্যাংক ইউ স্যার। another thing sir, in case of LSD, actually it is a poor farmer disease. আমার একটা গবেষণা আছে, যেসব বাড়িতে খামারিরা মশারি ইউজ করে তাদের এলএসডি কিন্তু খুব কম, অথবা অর্গানাইজড ফার্মে এলএসডি সংখ্যা কম। দ্যাট মিন্স if the farmers can use curtain, at that time the LSD percentage is very low. But in Bangladesh conditions, most of the farmers they don't use any curtain in their cow shed. Only open, in night all are open. Sometimes they use some the mosquito coil, but it is not sufficient for, because this is transmitted by only mosquito. Same mosquito that transmitted to the dengue. The same mosquito. When the dengue is overflow the country, at the same time the LSD is overflow the country. So I think it is the only poor farmer disease, not it is the one for এখানে অনেক বড় বড় খামারি আছে, আমি জানি না খামারি কখনো LSD আসছে কিনা। কেউ বলতে পারে খামারি LSD আসে। Thank you.
Now, whether lumpy skin disease is a poor farmer's disease, we need to investigate that. But as far as Maharashtra is concerned, lumpy skin disease, occurred, very widely. If you look at the route of transmission of lumpy skin disease, there are also, lots of ifs and buts. Now, there is enough evidence that it is also transmitted through contact. Okay. So earlier it was thought that it is not transmitted through contact, but there are papers published which is saying that disease can be transmitted even through the contact, and that contact could be even for a brief period of time. Probably poor people's animals are going for grazing because they cannot afford to feed the animal whole day. So they also go for grazing, and when they go for grazing, lot of other animals from the village also over there, and therefore the transmission the chances of transmission in such cases would be higher. And number two could be the immunological status, so because we know that immunological status is also related with nutrition. If animal is having very low body conditions, so naturally the immunity is also not there, and therefore such animals will suffer from diseases. I think that is my answer to your question. The second, the first question we asked is about my repeat reading. I think uterus is having anaerobic demand, and therefore except anaerobes, other bacteria will not grow. And unless and until we are introducing enough of anaerobic bacteria at the time of incineration, then only there is a chance that you could be doing that. Number two, when you are doing incineration, right? I'm saying correct. You are depositing cement at the surface. So you are not going up to uterus. And there is lot of mucus in your uterus. And that mucus contains lot of bactericidal activity also, it has been shown. So therefore the internal environment is such that the most of the infection could be introduced from outside can be handled. But I am always very cautious and tell the vets as far as possible not to administer any drug intra-uterine. And one of the important reasons for saying that is mostly uterine infections are coming at the time of parturition, and from uterus metastatic infection will also go to other causing mastitis. It will also go to lungs causing pneumonia. Therefore, these are three organ access for infection post-parturition. Therefore, if you want to give antibiotic, I prefer giving it parenterally so that the drug will get distributed to other organs also, and if there is metastatic infection, that will also be taken care of. So that is the reason I generally tell my vet friends not to go for intrauterine unless it is extremely necessary, but to go for parenteral injection.
আমি ফরাজ স্যারের কাছে একটা জিনিস জানতে চাচ্ছি। ফরাজ স্যারের কাছে একটা জিনিস জানতে চাচ্ছি, সেটা হলো কি ডিপিপিডি কেসগুলো আমরা যখন পাই দিতে তখন কিন্তু নিউক্লিয়াস সিক্রেশনটা খুব হিউজ হয়। এটা নরমাল স্ট্রেস সাইকেল দেখা যায় একেবারেই কম। কিন্তু এই ক্ষেত্রে দেখা যায় যে নিউক্লিয়াস সিক্রেশন কন্টিনিউয়াস হয় এবং সেটা হিউজ অ্যাট লিস্ট এভরি টাইম হাফ লিটার অর আড়াইশো আমি যেটা করি যে যদি আমি অক্সিডেটিভ সাইক্লিনটা যেটা নরমাল 50 মিলিগ্রাম এটা যদি আমি ডাইলুট করে অ্যাটলিস্ট 3 বার ওয়াশ করে তারপর রিয়াই করি, আমার এই কেসগুলো কিন্তু পরবর্তী দেখা যায় সেগুলো কনসেপ্ট করছে, কিন্তু যদি কন্টিনিউয়াস রিয়াই করতেই থাকে তাহলে কিন্তু এটা আর কখনোই কনসেপ্ট করে না। এটা তো আপনি জানেন।
থ্যাংক ইউ প্রফেসর সত্যেন্দ্র। রিপিট ব্রিডার্সের কিন্তু আমরা কারণগুলো যেটা জানি, তোমরা যেটা আমাদের পড়াইছো আর কি, আমরা প্র্যাকটিস করি, ঠিক আছে সংখ্যা ঠিক আছে, কিন্তু এখানে ভিত্তি দেখেন রিপিট ব্রিডার্স ওই ধরনের কাজগুলো হয় যাদের হাই লিঙ্গার 20 লিটার বা তার অ্যাবাভ যেগুলো মিল্কিং পার্সেন্টেজ, ডিজাইন পার্সেন্টেজ 75% অর মোর, সেই সমস্ত গাভীগুলোরই কিন্তু এই যে আমরা রিপিট ব্রিডার সিনড্রোমটা আমরা পেয়ে বা আমরা পাই, এবং তাদেরই এই লক্ষণগুলো দেখা যায়। এবং এটা আমার জন্য এক্সপেরিয়েন্স হলো যে আমরা এই সমস্ত গাভীগুলোকে যে পরিমাণে ব্যালেন্স নিউট্রিশন দেওয়ার দরকার আমরা ওটা পাই না। বিশেষ করে রাফনেস কনসেন্ট্রেট রেশিওটা মেইনটেইন করতে হবে। যদি রাফনেসের রেশিওটা যদি আমরা মেইনটেইন করি তাহলে দেখা যায় যে এই যে এক্সেস মিউকাস সিক্রেশন সেটা কিন্তু আসলে ওই সমস্ত গাভীতে আমরা পাই না। আর এখানে সাবক্লিনিক্যাল এন্ডোমেট্রাইটিস কিন্তু আগে রিপিটুলার কাউন্ট কিন্তু আরেকটা কারণ, যে সাবক্লিনিক্যাল এন্ডোমেট্রাইটিস সেটা কিন্তু ক্লিনিক্যালি আমরা কিন্তু বুঝি না। কিন্তু তুমি যে তোমার যেটা এক্সপেরিয়েন্স এবং আমারও যেটা যে হ্যাঁ এই ধরনের ক্ষেত্রে অনেক সময় আমরা ইন্টারলাইন আমরা অক্সিডেটিভ সাইকেল দেই না, পেনিসিলিন বা এটা যেহেতু একটা টাইম অফ এয়ারও করা যায়, দেখা যায় যে সকাল বা বিকালে দিলে এটা কিন্তু কনসেপ্ট করে, যেহেতু পেনিসিলিন বা স্পেকট্রোমাইসিন এদের কিন্তু স্পারমাটো সাইডাল কোনো অ্যাকশন নাই, যেটা আমরা প্রিজারভেটিভের কাজ করি সেই সেন্স থেকে দিয়ে দিচ্ছি যে ওজনের দল কিন্তু আমরা পাই। কাজেই আমার যেটা হলো অবজারভেশন যে আমরা যদি এই সমস্ত কাগজ যদি ব্যালেন্সিং করতে পারি, বিশেষ করে রাফেস কনসেন্ট রেশিওটাকে যদি প্রপার করতে পারি আর বিসিএস স্কোর যদি আমরা অ্যারাউন্ড 3 রাখতে পারি এবং আমরা হিট ডিটেকশন কারণ এদেরকে এরা কিন্তু বেশিরভাগই সাইলেন্ট স্ট্রাকচার এবং হিট ডিটেকশনটা যদি আমরা ক্যালেন্ডারে মার্কিং করে তাকে যদি ওইভাবে অবজার্ভ করি যে হ্যাঁ তার এই যে আমার হয়তো 7 তারিখে হিটে আসতে পারে তাহলে 2 দিন আগে এবং 2 দিন পরে তার যে অবজারভেশনটা 3 টাইম যেহেতু আমরা এনিমেলগুলোকে এমন ভাবে দুইটা রশিদে বেঁধে রাখি যদি এনিমেলকে আমরা মুভমেন্টের জায়গাটা দিতে পারতাম একটু হাঁটলে তাহলে কিন্তু হিট ডিটেকশন আদার এনিমেলস এবং সে নিজেই কিন্তু অনেকগুলা শো করতে পারত কাজেই এই হাইটিং এনিমেলগুলা অবশ্যই আমাদের একটু সারার ব্যবস্থা করতে হবে এবং 3 টাইমস হিট ডিটেকশনের জন্য অবজারভেশন করতে হবে এবং টাইম অফ এটা ঠিক করতে হবে। এই সমস্ত কাজগুলো দেখা যায় এমপিএম রুল সাধারণত মানে না এরা এই এনভায়রনমেন্ট এবং নিউট্রিশনাল কারণে তাদের দেখা যায় যে এই স্টাস পিরিয়ডটা লঙ্গার হয় 48 আওয়ার্স 72 আওয়ার্স পর্যন্ত ইভেন্ট সেই জন্যই আমরা যারা আসলে ভালো পালপেটার আমরা কিন্তু 3 দিন হিট থাকলে বলি না যে তুমি 3 দিনই আই করো কারণ যখন সেই এক্সাইটেশন এবং অন্যান্য থাকে সেটা কিন্তু প্রাইমারি হিট সেই প্রাইমারি হিটে তখন কিন্তু তার ফলিকুল কিন্তু ওইভাবে ম্যাচুরেশন কিন্তু হয় না সে এক্সাইটেশন ইন্টারসেট টোন কিন্তু বেশি থাকে মিউকাস বেশি সিক্রেশন হয় সেই জন্য অলওয়েজ আমাদেরকে স্ট্যান্ডিং হিটে কিন্তু আই করতে হবে এটা হিটটা মিনিমাইজ হওয়ার পরে স্ট্যান্ডিং হিটার 4 ঘন্টার মধ্যে এখন এটা তো আমরা এই যে রশিকে যদি যেভাবে বেঁধে রাখি দুই রশিকে আছে ধরাধরি করতে পারে না কাজেই তার স্ট্যান্ডিং হিট তো বোঝার আসলে উপায় নেই কাজেই এখানে হিট ডিটেকশন এবং টাইমলি এআই মানে 1 নাম্বার কারণ তারপর আদার যেটা আছে ফিজিক্যাল কন্ডিশন এটা খুব বেশি না 8% বা 15% এর বেশি আর হরমোনাল ডেফিসিয়েন্সি আমার যদি নিউট্রিশনাল স্ট্যাটাস যদি ঠিক থাকে তাহলে হরমোনাল ডেফিসিয়েন্সি যদি এখানে খুব একটা আসলে হয় না তারপরও আমরা সমস্ত ক্ষেত্রে পপুলেশনকে অ্যাক্সিলারেট করার জন্য জিএনআরএস বা এই ধরনের এলএস আমরা কিন্তু দিতে পারি তাহলে কারেক্ট টাইমিংটা একটু ঠিক করার জন্য থ্যাংক ইউ
See, recently, because in herd medicine, fertility management is an important part of the activity. So when we develop, protocol of herd management, we also use fertility management protocol. And recently we tested a fertility management protocol, for Nestle in Uttar Pradesh and some part of Madhya Pradesh, around 10,000 animals, and now that is being upscaled to 50,000 animals in the next year. You see what happens, every time we talk of every breeding, we start blaming cow. We don't look at this one. We don't look at the semen which is coming to you, what it is quality. Whether there are still motile spots. And we conducted a random test with the incinerators carrying the container, liquid nitrogen container. And with the microscope, we asked the people to move around and check the quality of the semen motility. And we find that 75% of these crops were having zero motility. So either they don't fill up liquid nitrogen at the right time, or they are not doing things properly. Probably they are getting semen from some unscrupulous. There are AI technicians who will tell me that they carry semen stock in pocket. They say no, it's not necessary to maintain liquid nitrogen. Also have to look at the male side. Do not raise all the time, the female side. And when I do the data analysis, larger data analysis, I always find that it is the side which is, and the semen which is, mostly responsible for anti-breeding. So therefore, you need to test. And it is very, very simple to also rationalize. You see, ova life is for more than 48 hours. And this sperm has to be agile enough to travel that distance and do fertilization. So what you need is very strong sperm. So semen quality has to be very good. So this aspect, need to be taken care of. So in that fertility program, at the time of distribution of semen, there is random, examination of the, one sperm we will remove and check for the motive. That is done. The second thing we have proposed is that animal should come in heat at day 30 at the most, between 21 to 30 days, first heat. It should be skipped. We are not covering, but you should observe that animal should come in heat in 30 days. So that will tell you that your transition management is proper, your energy level is proper, animal is not only giving you milk but also has started recycling. This second. Suppose up to 40 days, if it is not coming heat, then we say that the air diffusion should go and permanently came back. And we find that after doing parental examination, you can also try this. After doing parental examination, 50% of those animals will come in heat. Because you are healthy, he's seeing the ovaries, he's seeing the uterus, so you try tone will increase and some of this 50% will come. And then at day 60, we ask the vet to examine the animal if it has not shown any heat. And there the animals are classified into two groups. One is where ovaries are not active, that is true anismus. Where ovaries are active, either animal is not expressly showing heat or there is repeat breeding, after insemination. Or insemination time, etc. is getting delayed. So when it is anismus, then we say you give clomiphene citrate injection. Because clomiphene citrate injection will immediately result in ovulation. The crop will develop because it will stimulate the FSH and the crop of ova will come within 7 to 10 days. Animal will show heat and many times the first heat may not be ovulatory heat, but the cycle will start and next is from the ovulatory heat. So that is 50% part is taken care. The second part is where animal is having active, but it is not the follicles are persistent, the ova is not coming out, and then animal has shown heat 3-4 times it has been inseminated. They will say, okay, enough is enough, go for synchronization. So that is the best process, synchronization. You do synchronization, your 70 to 75% cases will settle down because you will be timed insemination. So again, timed insemination again, you have to look at the sperm quality and also you should take semen from those sites which are having high consumption rate in that area. We have found that very high ranking USA bull performed extremely bad in Maharashtra. And the ranking 10 and 15 in USA performed number 1 in Maharashtra. So there is lot of difference of performance of bull, geography to geography. So therefore, having regard of what sites are used and what is their fertility and conception rate is important. Based on that, you can pick up, or from your experience, you can pick up the best semen and then inseminate. If you have done it 4 or 5 times and animal is not getting pregnant, then even in United States with all kinds of treatment available, you will find at least 5% women will not be carrying pregnancy. So in cows also, you will have such animals. Due to anything and everything, they will not get pregnant. So the best option there is to tell farmer, please cull this cow and replace it with another cow.
Okay, sir. Thank you, sir. I think the last question to Dr. Vedwan. Thank you very much to these participants with very complicated things, daily nutrition. আমার কথা হলো যদি এক দরিদ্র খামারি তার একটা গাভী আছে 7 লিটার দুধ দেয় আর একটা 12 লিটার দুধ দেয়, এসব ক্যালকুলেশন কিছু বোঝে না। তুমি যে এটা দিলে দেখা যায় এটা সিসিটিভি ডায়ামিটার মেগা কিছু বোঝে না। সে তোমার এই ডেইলি নিউট্রিশনের এই যে ক্যালকুলেশন সে কিভাবে মনে রাখবে সেটা বুঝতে পারবে। মানে আমাদের যারা ডাক্তার আছে যাদের যারা একদম দরিদ্র কিছু দরিদ্র গাভী আছে, সে ধরো তার মতো করে এই এটা মনে রাখতে পারে। কি করে মনে রাখবেন এটা একটু বুঝাতে পারবেন। ডাক্তার সেটা যারা এখানে আসছে তাদেরকে সাপোর্ট দিতে পারে, সাজেশন দিতে পারে। থ্যাংক ইউ।
আমার খাবারগুলো একটু বড় বড় টাইপের তো এখন ওখানে আসলে জিনিসটা খাটবে না, তবে আমি একটু স্যার শর্টকাটে বলি। সেটা হচ্ছে আসলে এখানে একটা জিনিস করা যায়, সেটা হচ্ছে কনসেন্ট্রেটেড তো এনার্জিটা ফিক্স করে ফেলছি আমরা অলরেডি, যেহেতু 10.7 যেটা মেগা জুল এটা আমরা ফিক্স করে ফেলছি। এখন আমাকে ক্যালকুলেট করতে হবে বাকিটা। তো আপনি বলছেন যে দুটো গরুর ক্ষেত্রে, সো দুটো গরুর ক্ষেত্রে ধরে নিলাম বডি ওয়েট প্রায় কাছাকাছি, যেহেতু গরিব খামারি তার মানে তার গরুগুলোর ওয়েট হবে 250 থেকে 300 বা 350 মাঝখানে। তো দুটো গরুর ক্ষেত্রে ওয়েট যদি সেমই হয় তাহলে প্রোডাকশন পারফরম্যান্সের উপরে সামান্য টুকুই পার্থক্য হবে, খুব বেশি না। তো আমার যেহেতু কনসেন্ট্রেট অলরেডি আমি ঠিক করে ফেলছি, আর একটা জিনিস কি খেয়াল করছেন কিনা, সেটা হচ্ছে 300 কেজি গরু, তাকে আমি ডায়ামিটার দেখছি अराउंड 9.3 কেজি, মানে 3.1 এর মতো। তো প্রত্যেকটা গরু কিন্তু এরকম ভাবে কিন্তু খায়, সে মোটামুটি 3 থেকে 3.5 কেজি ডায়ামিটারটাই সে নিবে। এদেরকে যদি আমি কনসেন্ট্রেটটা যদি ফিক্স করে দিতে পারি, আর রাফেসটা যদি তাদেরকে তাদের মতো ফ্রি অফ চয়েসে দিতে পারি, কারণ এসব গরিব খামারদের পক্ষে তো ঘাস কাটাটা কঠিন না, তারা চাইলে ঘাস কেটে নিয়ে আসতে পারে। তো রোড সাইড গ্রাস খাওয়া বা যে কোনো গ্রাসই খাওয়া, জার্মান গ্রাসই খাওয়া, সেক্ষেত্রে তারা যদি গ্রাসটা যদি তাদেরকে ফ্রি অফ চয়েসে দেয়, তখন সে নিজের যেটা প্রয়োজন সেটা কিন্তু সে ফিল আপ করে নেবে। বাকিটা মনে হয় ফরাসি একটু বলুক, তার আগে আমি একটু কয়েকটা ছোট্ট প্রশ্ন আমি আসলাম উত্তর দিতে চাইছিলাম। আমার মাথায় একটা প্রশ্ন ছিল যে লিম্ফোমেনিয়া গরুর ক্ষেত্রে আমি আমার অভিজ্ঞতায় কয়েকটা জিনিস দেখছি, সেটা হচ্ছে কিছু গরুর ক্ষেত্রে দেখা যায় যে বালবার মধ্যে প্রচুর পরিমাণে লোক থাকে, এইসব গরুগুলো কিন্তু ক্লিটরাল স্টিমুলেশন দেয়, এরা কিন্তু আসলে লিম্ফোমেনিয়া না, ফলিকুলার সিস্ট অনেকেরই থাকবে না, এরা কিন্তু লিম্ফোমেনিয়া না। এইসব গরুগুলোকে আমরা দেখছি যে আসলে কালি করে দেওয়া ছাড়া কোনো ওয়ে থাকে না, এবং আমি বেশিরভাগ ক্ষেত্রে দেখছি যেসব ওই ব্লাড লাইনে যেসব বুলগুলো অনেক বড় হয়, ওই ব্লাড লাইনে বুলগুলো অনেক বড় হয়েছে, তার বোন অর্থাৎ যেটা ডিফার হয়েছে সেটার ক্ষেত্রে প্রবলেমটা অনেক বেশি দেখা যায়। আরেকটা জিনিস দেখা যায় সেটা হচ্ছে ইস্ট্রোজেনিক যদি প্ল্যান্ট খাওয়ানো হয়, যেমন অনেকে কিন্তু বাঁধাকপি খাওয়ায়, তো বাঁধাকপি যদি খাওয়ানো হয়, আবার অনেকে প্রচুর পরিমাণে সয়াবিন মিল খাওয়ায়, যেটা সামসা অলরেডি বলেছেন অলরেডি যে তার যতটুকু প্রোটিন দরকার তার চেয়ে বেশি দেওয়া হচ্ছে। সো সয়াবিনের মধ্যে কিন্তু আপনি যখন একসাথে অনেক নিতে থাকবেন, কিউমুলেটিভলি যদি আপনার ইস্ট্রোজেনের পরিমাণ যদি বেশি হয়, তখনও কিন্তু এই সমস্যাটা দেখা দিতে পারে। লিপিড ক্ষেত্রে স্যার এই প্রশ্ন একটা চলতে যাবে, আমরা একটা রিসার্চের কাজ করতেছি অলরেডি, এটা এখন পাবলিশ হয়নি, যেহেতু কাজ এখনো চলমান। সেখানে আমরা দেখছি আসলে যেসব গরুগুলো মানে লিপিড ফিডার না, বাট তারা টাইমলি হিট আসছে, মানে স্যার বলছেন 60 ডেজ ক্লাসের কথা, তখন আমরা এই গরুগুলোকে ভাগ করে আমরা কিছু গরুকে বুলের সাথে ছেড়ে দিচ্ছি। তো ফরাসের কথাটা আমি আসলে ব্যাক করতে চাই, সেটা হচ্ছে গরুর সংখ্যা কমিয়ে কিউমুলেটিভ প্রোডাকশন আসলে বাড়াতে হবে, আপনি স্পেস বাড়ায় দেন। আমরা নিজেরাও যখন ধরেন একটা সময় হলের মধ্যে ছিলাম, এখন যদি আমাদেরকে হলের মধ্যে ডাবলিং করে থাকতে বলা হয়, সো এটা আমরা নিজেরা পছন্দ করব না। সো গরুকে আমি ডাবলিং করতে দিচ্ছি আসলে ফ্লোরের মধ্যে, তাকে আমরা একটু 3 স্টার না হলো 2 স্টার মানের হোটেল হলো ব্যবস্থা করে দিই, তাকে যদি এখন কোন রুমের মধ্যে ব্যবস্থা করে রাখি, তাহলে গরু কিন্তু হিটে আসবে না। সো স্যারের কাছে আমি হ্যান্ড ওভার করতেছি।
থ্যাংক ইউ প্রফেসর রিপন। এখন প্রায় উত্তর চলে আসছে যে আমরা এইভাবে বলি যে আমাদের এখন কিন্তু বিভিন্ন কোম্পানি ফিড কিন্তু মার্কেটিং করে, আমরা কিন্তু পোলট্রি তো পুরোপুরি কমপ্লিট ফিডে চলে গেছি, এই রিটেও কিন্তু এখনো কিছু কমপ্লিট ফিডে কিছু খামারের ভিতরে চলে গেছে। রাসায়নিক ফর্মুলেশন যদি আমরা করতে পারি, যে যদি 17 বা 18% প্রোটিন যদি আমার থাকে, দেখা যায় যে 1 কেজি দানাদার খাবারে আমরা বলতে পারি যে 10 মেগাজুল এনার্জি, আর 1 কেজি ফ্রেশ ঘাসে যদিও ভেরি করে এখানে 20 গ্রাম মানে 2 মেগাজুল এনার্জি আছে। তাহলে আমরা যদি বুঝে যেটা হিসাব করলাম যে একটা 10 লিটার দুধের গাভী, আমরা যদি ড্রাই ম্যাটার তাহলে ইম্পর্টেন্ট যদি अराउंड 0 ড্রাই ম্যাটার করি, তাহলে কত এই 9 কেজি কিন্তু হয়ে যাবে। 9 কেজি ড্রাই ম্যাটার আমরা যদি अराउंड 3 ধরি, তাহলে এর এই অর্ধেকও যদি আমরা বলি যে 45% মানে 40 মেগাজুল আমরা এনার্জি থেকে দানাদার থেকে নিব, তাহলে আমাদের এখানে কত 4 কেজি সামান্য একটু বেশি 4.5 কেজি, মানে একটা থামরুলে 4.5 কেজি আমার দানাদার লাগতেছে 10 লিটার দুধের জন্য, আর এদিকে ঘাস লাগতেছে আমরা 2 মেগাজুল করে হিসাব করি, থামবে একটু কম বেশি হবে, তাহলে এখানে দেখা যাবে 22 কেজির মতো ঘাস লাগবে। এটা হলো যে এভাবে আমরা হিসাব করবো যে হ্যাঁ গরুর আবার কিছু গরুর বডি ওয়েট কিন্তু বেশি আছে 400 কেজি, সেও 10 লিটার দুধ দিতে পারে, তখন সেখানে তার বডি ওয়েটের সাথে কিন্তু মেইনটেন্যান্স একটু সামান্য বাড়বে, আবার যদি কম হয় একটু কমবে। তাহলে আমরা যদি অ্যারাউন্ড এভাবে হিসাব করি, দেখা যায় যে 10 লিটার যদি দুধ দেয় বা 8 লিটার দুধ দেয়, অন্তত দেখা যায় যে 8 গুণে 16 কেজি আমাকে কাঁচা ঘাস কম করতে দিতে হবে। আবার যদি এখন 8 লিটার দুধ দেয় তাহলে এখানে ধান দুধ দিলে আমরা 4 কেজির মতো দানাদার আসবে। তো এইভাবেও আমরা কিন্তু হিসাব করতে পারি। আরেকটা বিষয় আছে কিছু কিছু যে প্রথম 3 লিটার দুধের জন্য আমরা আগে হিসাব করতাম যে প্রথম 3 লিটার দুধের জন্য আমরা 3 কেজি দানাদার দিব, তারপরে প্রতি 3 লিটার দুধের জন্য এডিশনাল আবার 1 কেজি করে দেবো। সেভাবে একটা থাম্বে কিন্তু করছে। যেহেতু এখন আমাদের হাইডিং গরু চলে আসছে, বিভিন্ন প্রবলেমগুলো হাইডিং এর নিয়ে, কাজে আমাদের একটু ক্যালকুলেশন শিখতে হবে, ফাইনাল টিউনিং আমাদের করতে হবে। সব একবারে থাম দিয়ে আমরা কিন্তু ওইভাবে করতে পারি না, কারণ প্রোডাকশন যখন বাড়বে, বডি ওয়েট যত বেশি হবে তখন কিন্তু তাদের রিকোয়ারমেন্টটা কমবে। আমরা যখন 100 কেজির জন্য আমরা হয়তো 10 টাকার জন্য আমাদের দোষী বা 100 গ্রাম প্রোটিন দোষী, কিন্তু যখন এটা প্রোডাকশন বেশি হবে তখন কিন্তু 100 গ্রাম না, তখন আমরা 80 গ্রাম করব। ঠিক এইভাবে আমার মেগাসগুলো কমবে। কাজেই সেই জায়গাটা ফাইন টিউনিং আমাদের একটু করতে হবে। আর থামবে তো এটা আপনারা জানেন, আমরা এইভাবে থামবে গেলেও আমরা একটা খামারিকে পরামর্শ দেবো যে ঘাসের বিকল্প নাই। আর যদি সেটাও না পারে যে বডি ওয়েটের অন্তত 7 থেকে 8% আমরা গ্রিন গ্রাস দিব, সেটাও যদি দেই দেখা যায় যে আমাদের কিন্তু ওই পরিমাণের কাছাকাছি কিন্তু চলে যায়। যে বডি ওয়েটের মিনিমাম 7% যদি ঘাস দিই তাহলে 300 কেজির জন্য 321 কেজি, ওই যে 22 কেজি হিসাবে 22 কেজি আসছে 21 কেজি। কাজে আমরা কিন্তু এইভাবে ক্যালকুলেট করতে পারবো। আর যারা আরো ভালো খাবার করবে তারা তো অবশ্যই ফাইন টিউনিং ছাড়া হবে, আমার কষ্ট হয় না। থ্যাংক ইউ।
আমি রেফারেন্সের মধ্যে যে দুটো ইউজ করেছিলাম সেটা হচ্ছে একটা পেপার, ওই পেপারের মধ্যে কিন্তু চার্টই দেওয়া আছে একদম। যদি ওই পেপারটা দেখেন যে বিজেবিএস এর মধ্যে যে পেপারটা আমি এখানে কিউআর কোড দিয়েছিলাম, ওই পেপারটা যদি আপনি পড়েন, ওই পেপারের মধ্যে লাস্টে এনএক্স এর মধ্যে একদম দেওয়াই আছে আপনার 200 থেকে 250 কেজি গরুর জন্য কিরকম ভাবে প্রোডাকশনের জন্য একদম 600 কেজি গরু পর্যন্ত দেওয়া আছে। আর একটা হচ্ছে যে বইয়ের কথা বলেছিলাম যে ম্যাকডোনাল্ডস এর যে বইটা ডেইরি নিউট্রিশন, ওই বইয়ের পেছনে আমার মনে হয় প্রায় 30 পৃষ্ঠার মতো শুধুমাত্র চার্টই দেওয়া আছে ডেইরি এবং বিফের ক্ষেত্রে। তো যদি দেখেন আপনি গ্রোথ কত চাচ্ছেন অথবা আপনি কতটুকু প্রোডাকশন চাচ্ছেন, প্রত্যেকটা জিনিস ওখানে দেওয়া আছে, দেখবেন নিজে একটা ঠান্ডা আইডিয়া পাবেন।
Okay, thank you, sir. There are so many questions related on this fish. Dr. Momena, feedback practice আছে, এটা আমাদের যেসব পুরোগুলো রিপিট ফিডিং না, বাট কনসেন্ট্রেট করতেছে না, আমরা অনেকে হয়তো পুরো ইউজ করে দিলাম, সম্ভবত এটা ইউজ করে দেখা যাচ্ছে এগুলো আর পরবর্তীতে আর এগুলো কনসেন্ট্রেট করছে না। সেই বিষয়ে আমাদের কোনো অ্যাডভাইস দেওয়ার আছে কিনা? Number 2 question, Dr. Shiva. Actually, in the practicing field, there are so many right now there are so many cases in downers person. Actually, when it is occurred, it is just after delivery or after 1 month or after 2 months. Thank you.
Nowadays they're calling it as recruitment. So previously they used to have it as ground cow, and it is not related to pasteurization alone. It may occur at any time during lactation, gestation, and descending out animals, pre-functional, post-functional, like that. And so many classifications are there for downers cow, and according to the etiology only we have to treat that downers cows. So to elaborate the downers cow, it will take more than 2.5 hours.
Okay, so it was about the use of HCG. If we look at the function of HCG, it's the calories or active function. So the farmers were using the HCG. If it was a wrong treatment for that purpose, then the farmer was wrong, farmer was correct. So he or she should continue the treatment. So I will, as a veterinarian, I will investigate the overall condition, then I will decide whether I will use continue or not. But usually in Bangladesh, I think they use GNRS or nutrition is the most problem, and also if it is more than 10 years, apparently we don't consider the cow as a repeat breeding. It's something else. So you also need to categorize it as a repeat breeding or other problem. Thank you.
Another thing regarding soil, as you know, you just can go for a white side test. if you are suspecting any subclinical endometriosis, just to go for weight check test. Yeah, immediately you can within 5 minutes you can diagnose.
And there is also a formula for calculating the human age equivalent of that. And that is, 100 years taken for human and 20 years, the maximum lifespan is taken for cattle. So it is 5, factor is 5. So the age of the cow multiplied by 5, that becomes human equivalent age. So when you are talking of parity, that time you consider what could be the age at that parity multiplied by 5 and check whether a woman of that age will take it up.